Hello, I'm Evan Stultz at Comagine Health. I'm here with my colleague, Dr. Dan Lessler, to talk about contact tracing. As you can see, we're practicing social distancing by having this conversation from our homes, while we continue to work as hard as we can to assist in responding to the COVID-19 pandemic. So Dr. Lessler is a well-regarded physician leader, many years of experience both in public health and in healthcare delivery. He's our Senior Vice President for Clinical Leadership, and before joining us, he also served as the Chief Medical Officer for the state of Washington. So Dan, it's good to see you, and let's talk about contact tracing. Get us started quickly. What is it and why is it so important?
So contact tracing is a public health strategy that's been around for a long time, and it's used when there's an outbreak of an infectious disease to identify people who are infected who may have exposed others to that infection. And the idea is to find those other people who may have been exposed and to let them know that they've been exposed, and then to discuss and take appropriate actions, which might include quarantine. So this is actually something that's been used for a long time. As I say, recently used in this state, Washington, for a measles outbreak. It's used to track people who may have tuberculosis and such. So it's a commonly used public health strategy.
So from that point of view, there must be some best practices, ways to implement this that are known to be the most effective?
Yes, and certainly. I think first off is recognizing that contact tracing needs to be part of a more comprehensive strategy that includes testing, contact tracing, and then, as indicated, quarantine. And in the piece with respect to contact tracing, there are certainly best practices, and probably one of those has to do with how people are actually contacted and notified that they've been exposed to a person with an infectious disease. And the important part there is the ability to really quickly develop trust in that conversation. So when a person receives a cold call from a contact tracer, they are willing to enter into the conversation that needs to be had.
Yeah, I can imagine those have to be very challenging and sensitive conversations. So I'm just curious, are there ways to sort of turn to other programs or similar work to build on those kinds of skill sets?
And yes, and so this kind of skill set is one that is very important and commonly used by who conduct care coordination and case management. The kind of work we do at Comagine Health with clients who may have suffered catastrophic illness or catastrophic injury and need to be connected to and assisted with navigation through care. And in that context, there's this similar initial outreach that requires that initial conversation quickly build trust.
This all is creating an environment of challenging times. We're living in challenging times, and there's so much work to do. I'm curious, are you hopeful that efforts such as well-structured contact tracing are really going to make a difference?
I am. As I say, I think when contact tracing is used as part of a comprehensive strategy with testing, tracing, and then quarantine, and where people who are in quarantine, have what they need in order to maintain that quarantine, so that if they lack resources, there's a person who can connect them to necessary resources. For example, if they are living alone and need access to food, or if they're not adequately housed, with that comprehensive kind of approach and strategy, I'm optimistic that we can reduce the transmission of COVID, and we've seen this very strategy succeed in other countries, and so I know we can do it in this country as well.
Well, thank you, Dan. There's a lot of work to do, but strategies like this can provide a path forward. So thank you.
Thanks, Evan.